next speaker is Dr. Immad Qureshi. Immad is a specialty doctor in emergency medicine. He's working at the Royal College of Emergency Medicine, the simulation faculty. Is that right? And Immad is going to be talking about recommended apps for medical professionals to support high standards of medical practice. Let's welcome Immad.
Thank you very much, and thank you Apps UK and Dr. Chuktai and Egle as well, if she's around, for letting me try and close this round of talks. It's usually quite difficult. One reason being that they've cut 5 minutes of the time they've given me. Secondly, because almost everything I had to present has already been discussed in one way or another by the more esteemed speakers that came before me. So what I'm going to do is I'm going to very quickly go through some of the apps that I use in my daily practice, but then I'm going to come towards some bit of innovation in medicine. So not about how to visualize or the visions that other people have presented, but how is medicine going forward? We all tended to identify physicians and doctors with the white coats. That's no longer there. Now it's stethoscopes. But what comes after that? And we'll come to that as soon as I've gone through my disclaimers first. So I'm not an author or distributor of any of the apps. I don't get any kickbacks for them. And I do use a few of them in practice on a daily basis, and some of them occasionally when I need to. So the objectives of this is basically trying to show you what types of medical apps there are out there, besides the networking and communication apps that have been talked about. And how do we ensure that they are the best quality available? And that's already been talked about as well, so I'm probably going to skip that. But you can use guidelines, and again, the NICE Guidance app has already been touched on yesterday. You also have guidelines from the Resuscitation Council. You have the SIGN guidelines, and then your local trust may have provided or developed an app which has local guidance on it. This is, at my trust, it's called EM app, and it's an acute care guidelines which our trust uses. It was very interesting the way it was developed. All the guidelines were put onto PDFs and presented to an app developer and said, this is what we would like, and then there was continuous feedback provided for that. Obviously, being doctors, we do have to look into references every now and then, and well, sitting here at the Royal Society of Medicine and in collaboration with the Royal College of Physicians, I think there's no better place to showcase the Oxford handbooks, and they are available as apps on your phone. The BNF was touched on before. Previously, it was available in these two formats, and now it's being published as one combined app, and you no longer need an NHS email address to be able to use it. However, it's interesting to note when we talk about the quality being maintained, these apps are still available to download, but they will no longer be updated every month. This app, we're not sure how frequently it will be updated. So are you getting the best evidence or getting the right references? It's something to think about. Other references that I use a lot, Talkspace, again, is something we use a lot in acute practice, and it is available as an app. And you do need an NHS email address for it, though. ACEP is the American College of Emergency Physicians, and they have also a toxicology antidote app. It is very good. It's free to use, and I recommend it for quick antidotes if you got suspected toxic patients. Then there's some apps that different manufacturers will recommend, and they have developed, and I think some of these are quite good as well. For ultrasound, we've got SonoAccess, and then the famous EasyIO people have developed EasyIO as an app, and this also gives you video demonstrations to revise you on how to put in an IO. Obviously, we do a lot of critiquing, and we do a lot of referencing out of journals. So QXMD have a reading app, and then the BMJ obviously. And then there's a lot of online resources, up-to-date, Clinical Key, Hippocrates, Medscape, Access Medicine, Visual Diagnosis. A lot of them require subscriptions. Some of them, however, your trust might already be subscribed to. My trust is already subscribed to Up-to-Date and Clinical Key. Medscape is free for everybody. Hippocrates has I'm not sure if it's still working, but it has a free 1-year subscription at the moment using the promotional key Harvey Relief. Again, because I am an emergency medic, I tend to see a lot of things and be expected to make decisions sometimes that a specialist would be making. And so I use clinical decision-making tools or risk calculators. And QXMD and MedCalc and MediPlus are a few apps that I use for that. One very good app that I found is OrthoFlow, and this was developed by an orthopedic surgeon, a general practitioner, and I think an emergency physician as well. And these people have come up with a flow chart on how to manage different kinds of fractures. And I think it's really good for junior doctors as well. This is from the Royal College of Radiologists, and it will give you nice guidance on what the best radiologic imaging you should be using for certain indications. The Difficult Airway Society has come out with an app that gives you a flow chart on how to manage difficult airways. And then this is the eye manual. It's developed by the Ophthalmology Society of Australia, I believe. And it's really good in that it gives you different presentations, different differentials, and then how to manage those. And I think this is also something you should have in general practice or in acute care. Very quickly going on, we've got the GMC app, which lets you log your CPD points. I use SimMon for simulation. It's a quite expensive app, which I think it's about £30, but you can use it on your iPad and turn a very simple low fidelity simulation session into a higher fidelity simulation session and make it more engaging and get better rewards out of it. JSIP has a disaster preparedness app, and it walks you through how to do a methane report or how to prepare for a disaster in case one happens to be in your vicinity. It also lets you log locations on map grids with actual grid numbers. And then educationally, it's good to have some fun as well at times. You can play a few sessions on prognosis or on Lifesaver and see what how you should be managing some patients. I think that's about it for that, and I'll come now to a doctor's new best friend, the ultrasound probe. So, again, I will always come back to the fact that I am a generalist, I am an emergency medic, and I have had a lot of training outside the UK as well. So I've worked in the Middle East for a very long period of time at one of the best trauma centers in the Middle East, the biggest one in fact. And a lot of the things I've picked up there, I try to bring into my practice here as well and show my colleagues that there are different ways of doing things. And when we talk about management of patients in emergency medicine, we always talk about the A, B, C, D, E approach. So let's talk at ultrasound with that regard. How can ultrasound help me with managing an airway? Well, this ultrasound picture shows a patient who's been intubated, and you can only see one lumen. That means the tube is actually in the trachea because the esophagus is usually collapsed. The second one shows 2 lumens because the trachea is open and then there's a tube in the esophagus. So if you see a double lumen now, just putting a probe on the neck of a patient who's intubated, you can confirm whether it's intubation is esophageal or tracheal. For breathing, you can see lung sliding for pneumothoraces, or you can actually see pleural fluid, which could be a hemothorax in the context of trauma. For circulation, there's a huge amount of application that you can use ultrasound for. Obviously, you can do an echo in life support, or you can do a quick scan of the heart, see if there's any wall motion abnormality or a very dilated right ventricle. You can use it for vascular access, and that's the sternocleidomastoid muscle, the internal jugular vein, you've got lymph nodes, and you've got the carotid artery. You can use it to assess fluid status of a patient with looking at the inferior vena cava, where if it collapses or not, and how dilated or what the diameter is. You can also use it for fast scan in trauma, which is an application that's, I think, getting a little bit outdated, but it's still very useful at times. And you'd need a lot more time to go into the details of that. And also, you can use it to look for DVTs, which is probably a part of circulation. So here you can see that pressing the probe onto the patient's thigh does not compress the common femoral vein. So there's probably a clot in it, although in this one you can actually see it as well. Coming to disability, I found it very, very interesting that nobody that I spoke to knew that you can use an ultrasound probe to guide lumbar puncture. So this is a really good example. The patient is, you can actually position the probe and mark the centers, get a line, and then you can finish off with that, and you get a point for where you can enter. People do ultrasounds of the globe and look at the retinal disc, they look at the optic nerve and other problems or injuries to the eye. You can see retinal detachments, vitreous hemorrhages. And on exposure, I'll just quickly say that you can detect fractures and you can detect ruptured Achilles tendons, amongst many other applications. Thank you very much.
Thank you very much, Immad. I might take one question if anybody has any burning questions for Immad. Yes, Dr. Professor Amir.
Excellent presentation, Dr. Immad. Just one comment over here, that when you start using ultrasound for your diagnostics, you're not qualified to do it. You may attend a few courses, and it's important to attend the courses, have the record, and have your logbook as well. Because recently in our hospital, there was a patient who had postoperative complication. The intensivist, he was interested in doing an ultrasound scan. He did an ultrasound scan and he told that the heart was fine. And patient ID's postmortem showed that he had a large pericardial effusion, or the bleeding of the pericardium.
No,
and that takes him into the court. So having a disclaimer at the end of it when you're referring the patient to others, having another investigation to back yourself up and to cover yourself. But it's a great tool. And if we see in Europe, their junior doctors and everyone have this tool around their neck, and they go and they check the appendix for ultrasound as well. And they are very good at diagnosis.
No, I will say you're absolutely right, sir. And especially here in the NHS and in the UK, the system is so robust that you cannot defend yourself if you are not certified as being competent. Level 1 competency in ultrasound, however, is something that's required of every emergency trainee to progress to become a consultant. So if you are an emergency medicine consultant or a senior trainee, you're expected to be level 1 certified. You should be able to do quite a few of the scans I've talked about. Thank you.
Thank you very much, Immad. Give a big hand to Immad because he has been helping out throughout yesterday and today. Thank you, Immad.